Wonderful. So welcome to the second part of our conversation on art therapy. Last time we briefly talked about art therapy, outsider art, open art, and we mentioned historical figures such as the one of Hans Prinzhorn. Today we'd like to talk about the philosophical and psychological components of art therapy. Now, one of the questions that we started to analyze last week was, how can we relate to art in a therapeutic form if therapy is something that we do in order to change some elements of the person we are working with? Now, one of the things that are very controversial to this day in the context of the comparison between art therapy and outsider art is who is doing what and with what purpose. Now, we could, for the sake of time, define outsider art as somewhat of an art movement, and by then I simply define that as related to our system. So in other words, we do have exhibition of outsider artists, and we certainly have a financial component to the art system underlying these exhibitions. So what is art conducted within the context of outsider art, and what is art conducted in the context of art therapy? Well, in the latter case, we have to think about the psychological components of the practice, which are, of course, a series of practices somewhat more or less connected to psychoanalytic, analytic, psychodynamic, and psychiatric components. Some more recent example, of course, will also include humanistic psychotherapy, patient-centered psychotherapy, but nevertheless, the main concept is to utilize art in the context of a clinical strategy toward wellness, toward well-being. With outsider art, however, what is outsider, it's not so much the practice, but the artists themselves. So outsider means someone who is on the outskirts at least, or at least someone who does not belong to art as defined by quote-unquote art system, especially in the context of modern contemporary art. Now, this is very controversial because on one side there is the ethical component of making sure that individuals suffering from a wide range of mental disorders have the opportunity, given their skills, their artistic skills, to exhibit their work in the context of a protected environment. Now, from the ethical perspective, protected environment simply means an opportunity that's dedicated to these individuals and only to these individuals. So, at least on paper, what happens is the removal from the competition that has a capitalistic, financial, utilitarianistic even perspective beside what art is in terms of pure enjoyment. It turns out to be, however, a very complicated issue because one of the questions to ask is, all right, outsider art is art created by individuals suffering from a mental health disorder or multiple mental health disorders. So what would happen if the person, the artist, is in a position of feeling better? I would never dare to utilize the term healed from a mental health disorder because, of course, mental health disorders are not just neurological disorders, are not just problems within the psychological spectrum of possibilities, are not just differences in personality traits, more or less on the outskirts of the spectrum of possibilities in the area as well, but there are also social issues. And we would like to focus on that in the second part of this talk because the social component is a necessary component of making art. After all, this is a course in visual communication, so communication is essential, and the social component of communication is what makes communication happen, what makes communication as real as a piece of art on a canvas. So what will happen to a person who is healed, quote unquote, from a mental health disorder? Does this person still have the right or the burden of being considered an outsider artist? Outsider of what? Outsider of whom, might we ask? And that's one of the issues that we face every day when we think about outsider art exhibition. Now, these are very profound psychological and philosophical discussions that we need to have, but I also want to stress the fact that in many, many cases, outsider art conducted by experts in the field contains both a therapeutic element and also a high ethical standard. One of the differences, however, between art therapy and outsider art is also a difference in quality. I dare to say that in terms of skills, it would be easier to deal with outsider art if outsider art was just therapeutic. And let me explain what I mean by that. Psychology, psychiatry are fields that are necessarily connected to the medical field, that are part of the medical field, and by definition they navigate the gray area between science, knowledge, patient-centeredness, and art. Very often we hear the term medicine is an art and it is a science. Now, of course, medicine by definition is more of an art than a science, in a sense that it focuses on the patient, or it should focus on the patient. Of course, the knowledge that we utilize in medical terms is based upon medical research, which in itself is part of natural sciences. Psychology goes even more into the depth of the connection between person-to-person relationship. And it does that by virtue of opening up a much more profound discussion. A discussion that goes beyond etiological, diagnostic, prognostic perspectives, and definitely biostatistical analysis. However, even in this case, in general, there are two main purposes of the field itself. The main purpose is, of course, understanding, with a higher purpose to better prepare the clinician, the physician, to treat a certain disorder. The problem of treating a disorder versus treating the person is a problem that contains very important ethical considerations. On one side, we have a mechanistic explanation of the disorder, something that I recommend the student relate to the bibliographical references at the end of this PowerPoint and this lecture. But the patient-centered approach, the otherness, Levinas would say, it will really help bridge the gap between what I do not consider fully standardized self, and therefore I do judge as being abnormal, outside of the normal spectrum of possibilities. But at the same time, this outsider element, being outside the spectrum, is what makes outsider art so great. The expectation is not an expectation of conformity, it's not an expectation of normalcy even. And so outsider art goes beyond what art therapy could possibly do. Now, this doesn't mean that art therapy is an easy field. To become an art therapist, the person, depending of course, what rules and regulation and what kind of legislative approach we talk about, and each state within the United States and each country has a different sets of rules and regulation in this field. But the general assumption that an art therapist should have a solid background in counseling and clinical psychology, at least. Plus the added feature of art as art history, art practice, art understanding, art criticism. However, all things considered, an expert in outsider art is someone who goes beyond all these parameters. In other words, I would almost dare to say that anybody, at least potentially speaking, has the ability to become a good clinician, if by clinician we mean following specific steps on a diagnostic perspective to understand and treat a patient accordingly. But not everybody is born or has the chance to become an artist with a big A. So a big A representing going beyond those visual skills allow the person to represent real data as close as possible to reality. So while outsider art as a field can be very limiting because it presumes that construction of terms, the labeling of the outsider artist as someone who is on the outside of society, really, of the artistic society at least, which is not a positive thing in comparison to art therapy. On the other side, outsider art has this added almost spiritual value, almost metaphysical value in comparison to art therapy, to provide the artist with the biggest possible option within this parameter, which is the option of creation, the poetic option, the poem in Greek. Now, aside from this consideration, I would like to go back to our slideshow and talk a little bit about some of the artists that are connected to art therapy, outsider art, and open art. Now, I didn't really spend too much time talking about open art because open art is very often mistaken for art therapy or leisure activity, and this is especially true in the context of clinical psychology and psychiatry. Usually, open arts groups are offered as leisure type of activity in the context of occupational therapy or support groups or basic counseling services to patients that are otherwise occupied with clinical psychology, especially psychotherapy and pharmacological intervention. Art therapy instead is a fully clinical profession. It's a fully clinical practice that does involve diagnostic frameworks and treatment plans. Now, the fact that outsider art is the part of this discussion in connection to the art system leaves open art as free expression. So we could almost say that although open art does not have any specific goal per se, it does not have the goal of treatment, nor does it have the goal of potential exhibition. Open art is the part of our discussion has the biggest amount of potential and possibilities, because we are in front of an empty canvas. Now, a few artists that I'd like to mention in this context, whether you want to categorize them as experts in art in general, artists, open individuals, open artists, outside artists, or precursor of art therapy, it's something that warrants a much more complex historical analysis, which we'll leave aside for a second here, but at least I want students to remember a few names. Let's start with Alberto Giacometti, who was a Swiss artist, Swiss-Italian artist, and there are a few elements that I would like to think of when I think about Giacometti. And one of the things that is important to notice, as you can see in the images here, is this sense of ethereal self, minimalist and yet very dry and yet very human about the production. That is exemplified in the shapes, in the choice of materials, and in the overall relationship between lights and shadows, between fullness and emptiness. There is a sense of motion, there is a sense of inner struggle even, inner despair, inner sense of possible fall. Is a sense of existential living that it's somewhat connected to certain aspect of existentialist philosophy. I'm thinking about the classic Sartre and Camus. But it's also an archaic, primitive form of art, and in that sense it's definitely connected to arte povera, art brut, and the earliest beginnings of outsider art, because it brings forth this sense of archaic, almost primitive and yet visceral sense of self, unpolished but not by choice, but by inner spring, inner power, inner craving. Another artist that's worth mentioning is Adolf Wolfi. And similarly to what we said about Giacometti, although this time with a much more colorful palette, there's a vibrational element in this piece of art, and there is the sense of narrative, which is an essential component in both outsider art and art therapy. This sense of progression, process, unfolding, evolution, the usual volvo in Latin. The sense of presence and absence in front of the possible viewer that is part of the story told at the moment. We can think of many other names. We can think of names that are connected to the transcendental, minimalist, and as well as very intimate, we could say, component of making art, such as Vasily Kandinsky, for instance. And in this context, I would like students to focus on the reading that we opened up the conversation with 2 weeks ago in regard to the spiritual in art. So I'll recommend reviewing some of those writings by Kandinsky. And there are other elements that I need to focus on here, in the sense that there is this constant flow of inside toward the outside. There is this struggle for existence and existing struggle at the same time. Now, we talked about some of the existentialist philosophers, and of course, Being and Nothingness, it's probably the book that comes to mind when we think about this social cultural historical context. We're talking about the 1940s Europe, and in this context, the struggle of society, as society was destroyed by war, it was still in the process of being destroyed, and yet there's this sparkle of innovation, renovation, rebirth that defined that terrible conflict, is something that we find in outsider art and art therapy at the same time. So we move from a psychoanalytic, very subconscious, preconscious analysis of existence to something was very concrete. And this is also important because we're talking about the struggle that millions of people had to face, not just what happened during the war, but facing their own survival. The sense of guilt: why did I survive? Why did my parents, my family, my best friends had to die? What does it tell about my sense of self, about, again, my family, about my community, about my culture, about my nation, about humanity in general? And those are questions that will become more and more relevant also in the context of psychiatric treatment. Although we cannot really talk about post-traumatic stress disorder until the 1980s, really, from the diagnostic standpoint within the psychiatric field, what used to be called shell shock, it was nevertheless as real as a piece of art right in front of our eyes. The nakedness of art. There's a very important list of artists that produced some of the masterpieces of contemporary art in these 2 decades, 1940, 1960, and I'll recommend students to take a look at the information at the end of this PowerPoint. But I would like to quote a few more names here, besides Sartre, Camus, Simone de Beauvoir, in the context of literature, and other artists such as Jean Fautrier, for instance, that brought forth more than just a connection between the unconscious, subconscious, and the struggle, but also how the form and shape of what was art making was changing with the artist. So the art informel, for instance, the informal art. informal, which was also aformal, amorphic art, without a shape. Now, there is a tragic element in these art pieces, the same tragic element that we find in masterpieces such as Guernica by Picasso, for instance. The atrocity reverberate in the mind and the soul of the artist. And this is something that you find in Fautrier, but you find also in Richter, for instance, the German and Austrian art movement. You find in Bourdelle, you find in Brasset, and many others. You find some of the same vibrational element that I mentioned earlier in Harry Moore, for instance, and in this almost choking existential narrow element that needs to be discussed, more than just discussed. It's screaming, it's yelling at us, it's reverberating from the deepest recess of our soul. I think of King and Queen, for instance, as one of the examples by Moore. Other important artists in regard to this movement, Francis Bacon, and also this twilight zone, we could say, between the sacred and the profane, between the flesh and wound and bone and blood reality of human existence, again cut and dry and yet still pulsating, and then this hierarchical golden ratio beauty that is extremely apparent in looking at his paintings. Something else to be said about outsider art and art therapy. The usual comparison between genuine and Foley that we discussed last week has to do with the collapse of civilization as we knew it. As we knew it back then, of course, we're talking about a series of changes that involve somewhat of an interpretation akin to Foucault, for instance, madness and civilization, and the challenge to historiography as we know it. So let's go back to our PowerPoint here, and one of the things that I would like to comment upon is the connection between the elements of logic as related to the logos, of course, as opposed to madness related to Foley, and how this influenced the language, the visual language, the communicative language. And this has to do with the ability of our mind to interpret the world, also to test boundaries, to express one or more truths. Of course, there is a problematic understanding of the perceived absence of universal truth in this context. And so everything is possible and everything has to be possible. So in other words, we are similar to what the existentialist notion of constricted free will, constricted because we are fooling ourselves really to think that we are completely free, and yet we are free to create our own meaning, but we are doomed because we are free to express ourselves, to find meaning. And human beings do not deal well with this existential freedom, with the lack of boundary, lack of rules. Now, madness, of course, is a term that, from the perspective of what we're trying to do here, moves from the medical to the moral, and back to the philosophical, the existential, the transcendental, the spiritual and religious. And in any case, it creates a sense of awe. Something that society wants to control, needs to control, is unable to control, is fascinated by it. Now, as a result of all these developments, art therapy, outside art, open art, art brut, art informel, arte povera, and so on, there is, of course, a positive outcome. And the positive outcome is this patient-centered approach that more and more is becoming reality also in the West. The West is, especially in the United States, is a little behind in comparison to other geocultural areas. And in this context, I just want to mention the Legge Basaglia in Italy and the following patient-centered approach to treatment that attempted to remove hospitalization as psychiatric wards that were confining institutions that were really depriving the individual of any sense of self, any sense of freedom of existence, and viewing psychiatric disorder as type of disorder that are not in order by definition, but that are still nevertheless on the social spectrum of possibilities. Within outsider art, within the therapeutic element of art, of course we have dance movement therapy, we have music therapy, and we have theater. So performing arts as this new connection between mind and body, and a new connection between what's inside and what's outside. So another form of communication that, just as visual communication, utilizes different words, symbols, a new jargon, a new dialect even, a new slang, they make us more prone to interact with one another. We are naked in front of the otherness. Again, remembering Levinas. Now, there is a darkness within ourselves that art therapy targets, and I'm thinking about Le Marquis de Sade, I'm thinking about Foucault again, I'm thinking about Nietzsche, and I think about Diderot. And a piece of art that comes to mind in this context is The Sleep of Reason by Goya. And this sense of possibilities that we have to face. We have to face our darkest self. And to some extent, this is also built upon certain parts of Jungian psychology, especially the animus and the anima, and leads to an entire reform of psychiatric treatment. Now, on the outskirts, we talk about a spectrum again, of the psychiatric treatment, of course, there's an entire movement known as anti-psychiatry, and this is another very important discussion we should have, but within the context of visual communication, which is the main goal of this class. I just want to mention a few names. Of course, Dr. Shash, it's probably one of the most commonly heard names within the anti-psychiatric movement. I also want to mention Mad in America as a book, so Robert Whitaker, Sandy Steingart, all those very, very important names. Dr. Blom as well within the field of bioethics, medical philosophy, and so on. So what is in the end the relationship between art and madness? Well, it's the relationship between what's inside and what's outside. The intuition, the ability to go inside, to go within, intuere in Latin, intuition. So how can we define this? Well, let's take a look at our slideshow here. We're talking about slide 42. What is the art of mentally ill? Here I just use a few quotes here. Exists outside of lineage and contemporary community. It exists on its own. Sometimes we could say it exists as a result or as an attempt to fight back the quote-unquote real art system. So it cannot exist on its own because it's a representation of the contrary of something else, is in opposition to the art system. And yet it often demonstrates an awareness of conventional notions and aesthetics. We talked about aesthetics in terms of certain parameters. Outsider art, by definition, does not recognize this as necessary or even meaningful parameters. And of course, it reflects not just the perspective of the artist, the intent of the artist, but the artist's uniqueness, the artist's condition, whether this condition is a psychiatric condition, as in affect, presentation, and so on, awareness, or a condition of being. Again, this existential component. A few more artists that I think we should mention: Wolfley, Van Genk, Willem van Genk, Francis Palang Baya, many others. Now, Deutscher, of these artists. Few things, however, that I would like to keep in mind is this transgression element underlying outside art and art therapy. So exploring the boundaries, the possibilities, and the notion of what is ethical and what is moral. Whether it's moral is whether we want to consider morality in a sense of a series of behavioral rules that society accepts, or whether we want to consider morality as the highest possible achievement within this behavioral spectrum, which is something that, of course, outside art willingly or unwillingly refutes, fights against, and which is similar to what we find in literature with Artaud and Bataille and Tonnet. And there is and there are views within this madness as possibly, Foucault said that something along the lines that madness is the end and the beginning of everything, and also the need of getting rid of the notion of a masterpiece, of a master even, in the sense that everything is a masterpiece and nothing is. It's the destruction of the system from within. Now, maybe one of the other elements to keep in mind here is this destruction of the system, which is the destruction of the art system, the social system. So in that sense, we're not too far removed from Duchamp, for instance, but it's also destruction of psychological notions, psychological practice, psychiatry as a field. And when we think about these parameters, there is one name that comes to mind, of course, within philosophy, and that is the name of Wittgenstein. Again, such an important name that I really advise students to research on their own. But it's this notion of constraint from a biostatistical analytical sense of self, and yet also the fight resulting from the absence of certainties and rebuilding a sense of self. And this is because, of course, the traditional notions of psychiatry are limiting the possibilities. And so we want to remove any type of boundaries, any type of obstacles in our effort to reach out to the patient as an individual, to the patient as an artist, and even more so to the artist as a person, because even the term artist at this point ceases to make sense. It's not separate from the rest. It's on the outskirts, an outsider from the expectation, and yet it's fully present because we all are. And this is, again, the theater and the tragedy of life, in a sense that we are observing, again, within outside art, within art therapy, this notion of recreating a sense of self based on the words of the person. So that there is some sort of, I would dare to say, motivational interviewing part, especially in art therapy. Motivational interviewing in a sense of allowing the client, the patient, the individual, the subject in review, the subject object, this otherness of the person in front of me, to freely express themselves and telling me, the clinician, the physician, and so on, the art therapist, what the most important things for their recovery are. And so from this perspective, motivation interviewing is nothing new. We could say that it's the Socratic method still at work here, the maieutic component, but it's this theater of tragedy as re-representation of something has to come out. And this is one of the most fascinating things of utilizing art as an added, different, ulterior form of communication that makes us more aware of who we are. So thank you, and we will continue next week.